it's very rewarding to be a part of that and help raise awareness.
And Brian, by way of background, we'll bring Dr. Sood into the discussion.
Yes.
Because he's got a great pedigree. I've known of him. It's very nice to meet him today in person. I really have a lot of respect for his work. He leads the Sood, that's S-O-O-D, Sood Center for Aesthetic and Plastic Surgery, and they're right here in Linwood in Central Square. Great work that you do, doctor, and I think it's really important work because when you have someone that's already dealt with disease and maybe something has had to be removed or altered, the cosmetic end of things in terms of the total rehabilitation of the patient, I don't think you can overstate how important that is for the esteem and just the psychology of the patient.
Yeah, I totally agree with you, Harry. I mean, it's one of my biggest passions in my practice. It's something that I think every woman should at least have the opportunity to be evaluated for. You think about a woman who's gone through a breast cancer diagnosis, right? So they basically got a mammogram, they had a biopsy, and all of a sudden they're in this situation that's life-altering. And you think about their journey and what they have to do. They now have appointments with oncologists, they have more imaging to do, they have surgeons to see. And so what we really do in our office is try to create a totally different atmosphere and say, look, we just don't want to be one of the many doctors that you end up seeing. We want to be the doctor that allows you to get control back in your life, you know? So you're going to go through potentially chemo, potentially radiation, potentially surgery, all of which are based on guidelines and recommended, and you know we stand strongly by. But in our office, when we talk about recreating a breast mound for a woman, it's more about patient goals and patient-centered in that way, because we don't dictate whether you should be an A cup or a D cup or a C cup. They get to actually state that, and we just try to make those goals happen for them, and that's our key in what we do in our mission.
And you know, Dr. Sood, I think it sounds like a cliche, but I really mean it. How you look is how you feel. If you don't feel that you look attractive and you don't feel complete, that's going to affect every essence of that person's being.
Absolutely. I mean, clearly with a cancer diagnosis, depression is at the forefront of you know, the pathology as well for a patient experience. And when you look at, there's actually clinical studies that demonstrate performance scores in women who've undergone breast reconstruction versus those that have not. And you can see that their sexual health is better, that their work performance is better, that their family care is better. So they identify better with themselves. And so that's really, really key to the overall healing process. We have women who have come out of the woodworks, which has really touched me personally, who have undergone mastectomies or breast-altering surgeries 10, 15 years ago, who now come back and say, is there an option? And you know, we provide those options, and to see them walk through the journey even 10 to 15 years later is an amazing process. You know?
And a quick reset and time check. We have about 5 minutes left in our program today. We want to thank Shore Medical Center Presents for the opportunity for us to also present Miss America 2017 Savvy Shields. We usually go about another 15 minutes each month with Shore Medical Center. We're listening and visiting with Dr. Mohit Sood, and we just told you about his aesthetic and plastic surgery center in Linwood, and you've heard from Danielle as well, Danielle McDevitt, who's the community manager from the American Cancer Society, and we've been promoting the upcoming Sunday, October 16th, Making Strides Against Breast Cancer Walk, and that's going to be, I know it's going to be a huge success, Danielle. Brian, we have about 4.5 minutes, whatever you want to conclude with.
Well, I'd like to continue with Dr. Sood, if I could. So if you can kind of take someone through the process, do they come to you, or at what point? I guess the question is, at what point do they come to you? Whether it's like you were talking about 15 years after is fine, but is it right away, and how does somebody even find you to do to have a procedure done?
So basically, you know, cancer care at its finest is done at a multidisciplinary institution where you have multiple specialties working together, and that's what we have at Shore. And so they typically see their breast surgeon, and based on their current needs, they're deemed candidates for potential reconstruction, so they're referred my way. And most of the breast surgeons at Shore refer patients forward who they think might have disfiguring breast pathology. And so we work in a collaborative effort. That's one of the things I've enjoyed the most, honestly, is that we individually plan for each patient, whether it be incisions, whether it be surgical planning, and really try to work as a team approach so that multiple surgeons would be available the day of a patient's surgery, so patients can undergo immediate procedures so that they don't ever have to wake up without a breast mound present, even though they may be losing a breast.
So someone like Dr. May, who we were talking about before, is Dr. May someone that, excuse my ignorance, but is Dr. May someone that you would work with on a regular basis in this
We
case?
work together on a routine basis, actually, and you know, due to his open-mindedness and, you know, my constant push to strive for better for these women, we basically are creating individualized plans. We're doing now nipple preservation surgeries and the most advanced techniques that we possibly know together, so that we're giving every patient the best possible outcome that we can do on their end.
This is so impressive to listen to, because rather than you just accept a patient after it's all done, you can be a part of actually how it goes.
Absolutely.
It's big.
We plan that with the oncologist. You know, obviously some of these patients need radiation and other therapies, potentially chemo. And based on whatever their entire process is going to be, we as reconstructive surgeons never want to interfere with the oncological care, not at all. We want to be a part of the rebuilding process like we suggested, right? And so we have to understand that process. That means we have to be involved up front to know what the journey is actually going to be for each individual patient, and then go and create a plan that works within that mold for everybody.
2-minute drill.
It's so impressive, and again, it's since the day I started Assure, I've heard about you, and I've always wanted to meet you. So I personally thank you for coming today. It's been a pleasure, and the work that you do is really incredible. I've had some personal some people that I know personally who've been touched by this, and the psychological trauma that they go through, and the work that you do to help these people is phenomenal. So I thank you for that, and for being a part of what Shore brings to the community.
I want to give Danielle a closing comment, and then I have a last question for Dr. Sood. Danielle, anything you want to share?
Yep, I just wanted to encourage everybody to log online today and see if they can come out and support one of our local events. And I also just wanted to take a moment to thank Shore Medical Center for all of their involvement helping us out this year and giving me the opportunity to be here with you guys today.
And go ahead, Brian.
No, that's good. That's
my
good.
my last question to Dr. Sood, and I think it's a good one, but you know, if it's not, you know, it's not. But I was thinking about how a patient that hears that they have cancer and then they have to deal with the cancer, your first, I think, order is you want to survive, but you also want to survive and you also want to still look good. So how does that, what can you say to your listeners in terms of all that they're going through, and that at the end they can still look good as well?
Well, beauty's from within. That's what I always say. And so it's a mindset, to be honest with you. We can't predict what nature's course really is, but we can optimize healing, we can optimize strategies, we can optimize plans working together. And when we empower patients with the ability to make choices as it relates to the reconstructive efforts, that's the key to the overall healing process. That's how pride in the result comes back. We can do, you know, we offer a number of different techniques, whether it be implant, whether it's using your own body to rebuild your breast. I mean, some women get tummy modifications and tummy tucks off of breast reconstruction in an effort to enhance both the aesthetics of the abdomen as well as the chest. And so with nipple reconstruction, tattooing, fat grafting these days, there's so many different options for these women that are out there. So it's really about, you know, having a good sit down, understanding those goals. You'd be surprised how many women come in who have prior been augmented, reduced, or had other breast surgery in the past. So it's, you know, it's very common, to say the least, so we try to address those issues.
Dr. Sood, great conversation.
Thank you.
And Danielle McDevitt, Community Manager at the American Cancer Society. Same to you, Sunday, October 16th, mark it down. We're going to continue to promote it here on Hurley in the Morning. Making Strides Against Breast Cancer Walk will be taking place in Ocean City. Brian, thank you. We're going to reconvene on Wednesday, October 26th, our next edition of
Very
Shore
good.
Medical Center Presents. Thanks, Brian.
Harry, thanks again.
You're welcome.
Thank you.
Thank you, guys.
When we come back,